the government's announced it's to give £240 million to GP practices this year to improve what's called primary care. The money to be used, they say, to introduce online booking tools and upgrade telephone systems, therefore improving access to see a doctor, says the government. Well, the aim to end that so-called 8 a.m. scramble, patients all ringing at the same time to get a slot. But some NHS providers are saying there must be more done to attract and retain primary care professionals, including doctors. Well, let's get the view now of someone on the front line. NHS GP Dr. David Lloyd joins us one more. David, thank you for joining us once more on GB News. How is your telephone system working at the moment?
Well, I think I hate to say it, but this is something that governments do every time. They say they're going to announce something new, when in fact it's old news and old money. So most GPs in the UK have already switched to digital phone systems. They use all these clever things like call queuing and voice over IP and branching and things like that. Certainly in our practice, some GPs are actually using chatbots now to explain to patients how to register with their systems online to improve communication. And that's actually being done in several parts of the country. So I'm afraid this is already done and dusted and is actually part of our contract. But it does expose a much deeper problem, which is just how difficult it is to get to see a GP and just how few of us there are.
So you would share Wes Streeting's analysis that it's not necessarily the phone system, it's actually having enough GPs for people physically to actually then get an appointment with?
Well, I think I have some issues with Wes Streeting's plan for the NHS and general practice in particular. So I can't fully support his ideas, but obviously he's saying the right things. But it is so difficult, isn't it? Every patient who comes and sees me now is so grateful to have an appointment to see me that they treat this appointment as if this is going to be the last one before they die. And so they like to get everything out of the way. So 10 minutes is a bit difficult to do that. A very humorous GP in one of our trade journals actually made a sort of idea that if you do everything that a patient asks, a consultation that should last 10 minutes will actually last an hour and 40 minutes.
So they're trying to get value for money by putting it all in one go then. So, however, let's just touch on this idea about what they call care navigators, where the suggestion is that the receptionist has some kind of triage training to sort of ease the load. What's your reflection on that? I suspect a lot of people would be rather uneasy with a non-medical professional telling them whether they're ill or not.
So for a long time, GP receptionists have had a terrible life because they're the ones who have to take the first call and they're the ones who have to tell patients to ring back again or say there are no slots or say that they just can't talk to a doctor. So they are the hidden stars of general practice, if you like, and they're paid rubbish and they do the most extraordinarily good job. So, yes, I think it's time we recognise what an amazingly skillful group they are. And let's call them care navigators, because I think that's something that's a very good idea, so that they actually play a part of the system so they can get the right care to the right people at the right place. So, yes, I'm all in favour of that. GP receptionists have had a terrible press because they have a terrible job.
Right. Well, apparently there are 6,000 or 6,500 training places for these posts. I mean, should they therefore get some kind of medical expertise then in terms of this triage role? Well, they already do. They live and work in general practice. Our receptionists are astonishingly good at deciding whether someone is ill or sick. They've got a lot of background knowledge. Most of them have got families of their own at home, so they know about the health problems of most people. So yes, training is vitally important, and I think we should accept that they have a very key role in helping general practitioners. OK, and just very quickly before you go, your thoughts on pharmacists. We understand Rishi Sunak may announce plans tomorrow to ensure pharmacies have support they need to help GPs and ease the pressure in primary care.
So this is an enormous one, and I can't do it justice, but my pharmacy, I cannot do without our local pharmacists. They are a very, very important source of information, and they are really under pressure.